she's now bleeding from her mouth.
Her gums look like they were burned.
Acute myeloid leukemia can cause swelling in the gums.
She hasn't been exposed to a chemical toxin.
There is one other cause of AML.
We need to get her into an isolation room and prep for a hematopoietic stem cell transplant.
We found reports that your company was developing tactical nuclear warheads for bunker-busting bombs.
Wendy has gone from dealing in drone strikes to designing nukes. If this rabbit hole sinks any further, then I might have to get some light relief from a Black Mirror episode. Very excited to be reacting to House MD Season 7 Episode 21, The Fix. On this channel we are reacting to all 177 House videos, and this will be episode 153. Let's see if I can get the diagnosis before House does as a doctor working in London.
I have been fantasizing about this for months. Target area is clear. Repeat, target area confirmed clear.
2, 1.
I feel better already.
Wendy! Call 911!
Karma's a bitch.
You think her seizures are the result of bad karma?
It's not going to be easy to break into her office. You might want to start with her home. It could be a tumor, it could be a CNS bleed. But what do you do when you got two interesting puzzles?
2?
Bets off. Fight was fixed. That punch barely even touched it.
Prove it or pay up. You got one day.
I guess your luck finally ran out.
Takich doesn't like people who make bombs.
I've always loved explosions. Bombs are tools, just like anything else. You can use it to make things better. Is there anything else you want to know before we do this MRI?
Nope. I'm not here to judge. You did what was best for you. I got no problem with that.
I didn't take a dive.
Ha! Proof. He has anisocoria. He has Wolff-Parkinson-White syndrome.
One possibly photoshopped cell phone pic does not a diagnosis make.
I'm a co-worker of Wendy Lee's. I'm also her boyfriend. Her last boyfriend was a real nut. He's basically stalking her. I think I know what's wrong with her.
Apparently our mad scientist is also a slutty scientist.
And when we tested her blood and cerebral spinal fluid for toxic exposure, it was negative for every poison we could think of.
Couldn't hurt to start activated charcoal, see what happens.
Looks like she actually was being poisoned, but she's been doing it to herself.
It's a little too coincidental, isn't it, that just as they gave the order to test the weapon and therefore blew up Wendy's photo, the real Wendy goes down. 13 seems to be happy about the situation considering the patient's position as an envoy of explosions, but it appears she may be torching more than concrete slabs since an alcohol addiction seems to be in play. So what else do we know so far? She apparently has never gotten sick before, had a seizure, has possibly been poisoned, although she was negative on all her toxin screens, and had a normal MRI scan of her head. Normal MRI doesn't necessarily mean a normal brain though, as structure can differ from function. That is why we do EEG, so we can measure more of the brain activity patterns rather than just how it looks. Like a car may look good, but you open up the hood and realize that the engine is missing. Well, sort of similar. Now, alcohol can trigger seizures, but that is a bit too obvious here. What might be more interesting is if the patient has had multiple partners, is drinking, and has an affinity to calamity, then she may also be prone to impulsivity. Maybe if she travels for work a lot, then she may explore more than just the local cuisine and picked up a sexually transmitted infection. If she got neurosyphilis, it may not necessarily show up on her MRI scan or even initial tests and could cause seizures as well as memory problems or personality changes. It could be a relatively easy fix as well once they diagnose it. They really didn't give me much to go on here, but I'm hitting neurosyphilis as my first diagnostic guess. Let's get more clues.
You just collect bottles.
Yes, I collect them from my friend. She uses them in her art projects.
If she's an alcoholic, why doesn't she have at least some partially full bottles in the house?
So she's probably telling the truth.
One normal EKG does not a healthy person make.
Look, I told you I just suck.
Yeah,
Why do you care so much?
Stop! My leg hurts. Okay, just talk to me for a moment. You don't have to be a loser. Sick means it can get better. You can get better. You don't have to suck.
Figure out what's wrong with yourself. Leave me alone.
Abdominal pain.
She said it felt like she was being stabbed.
Acute pancreatitis from alcoholism would cause this kind of pain.
It's definitely not pancreatitis. Restarting the treatment obviously didn't help anything.
CT and ultrasound show inflammation in the renal capsule.
What looks like Wolff-Parkinson-White, it isn't.
Underlying neurological condition exacerbated by an acute UTI brought on by her sexual escapades.
You ignore us, all the time, but you answer pages. You sleep. Is there anything I can do to help?
Although... you have an underlying neurological condition, which together with your heart...
You said my heart was fine.
Sympathetic overdrive. This is about dignity for both of us. Give me your arm.
What the hell?
It's just epinephrine. And you are tachycardic.
Are you psycho?
I'll explain more when you wake up. Now, the punch that supposedly knocked you out looked like it was thrown by an old cripple.
You're embarrassing me.
Doesn't make sense.
House is cooking up trouble not just on a spoon but also in a boxer's base gym. I knew the man had courage, but if he carries on like this, then the puzzle may have to be solved with a consult from above. He's fascinated by the boxer's mismatched eyes and lack of consciousness after being grazed in the chest, but seems to have normal tests afterwards. We also know his heart rate went up after being given adrenaline, which, I mean, I'd be more worried if it didn't. So what can cause him to pass out like that? I've got a theory. Maybe he has a narrowing of the artery around the neck called the subclavian, which leads to reversed blood flow of one of the arteries that supplies the brain, called the vertebral artery. What fits even better is during arm exercise like boxing. This gets worse, stealing blood from the brain and can cause someone to pass out. Oh, that would work so well here. So a boxer gets a first diagnosis of subclavian steal syndrome. Treatment would be to unblock that artery either through medications or a procedure depending on the cause of the blockage. But what about our other patient? Well, the team found that she has some inflammation around the kidney. They've got a theory that she has a sexually transmitted infection triggering a neurological condition. I mean, my theory was that the sexually transmitted infection was the neurological condition, so clearly I was wrong because it's way too early for them to get the diagnosis. So what else could this be? Well, that inflammation around the kidney could mean she has some kind of vasculitis that is affecting the brain and kidney. Granulomatosis with polyangiitis could potentially do it. I'd be interested in doing an autoimmune screen, but also interestingly, we know they've tested the fluid around her brain and spinal cord already, and that was negative for toxins. What about infection? That would be helpful to know, Genius team. But where'd the fun in that be though? All right. Go for vasculitis, possibly granulomatosis with polyangiitis as my second diagnostic guess. Let's get more clues.
She's in VTAC. BP's dropping.
Whatever you're doing isn't working again.
Here, she's having a heart attack. No pulse.
And this patient is gonna die.
Not if you do your job.
You're an idiot.
That's not heroin.
Compound CS804. It's supposed to regrow muscle.
This experiment was done on rats.
Well, you got 4 legs. Look how fast you should work on 1.
You're an idiot.
Smells like bleeding.
Rectal?
And vaginal.
It's a blood disorder, coagulopathy.
We need to treat the underlying condition.
You done maximum tolerated dose studies?
Not yet.
Leg hurts. Would you mind getting me a coffee?
She's now bleeding from her mouth.
Her gums look like they were burned.
Experimental drugs? You want unhappiness to have a cure.
Acute myeloid leukemia can cause swelling in the gums.
She hasn't been exposed to a chemical toxin.
There is one other cause of AML.
We need to get her into an isolation room and prep for a hematopoietic stem cell transplant.
We found reports that your company was developing tactical nuclear warheads for bunker-busting bombs.
Wendy has gone from dealing in drone strikes to designing nukes. If this rabbit hole sinks any further, then I might have to get some light relief from a Black Mirror episode. So she now has bleeding from every orifice and seeming burn marks from the gums, and the team think it's leukemia. Are they right? Well, exposure to radiation like that used to build a nuke, for example, could trigger a blood cancer, but usually this doesn't present with seizures. It tends to be pale skin, tiredness, breathlessness, and unintentional weight loss. You can also get unusual bleeding, including from gums, but not necessarily the burned appearance that they mention. In all fairness, the only time I've even heard of this symptom happening was because of people who were tooth whitening with hydrogen peroxide and kept that on for too long, causing actual burns. That wouldn't explain the other symptoms though here, like AML would. We also know there are some other conditions that can mimic leukemia and fit better with the vengeful boyfriend history, like if she picked up a specific viral infection such as Epstein-Barr. If she got a severe version of it called hemophagocytic lymphohistiocytosis, that could be life-threatening and need steroids, as well as a stem cell transplant to fix. That would work here pretty well, so I'm going to go with Epstein-Barr virus infection as my third and final diagnostic guess. We are locked in.
You need a drink.
Dr. Foreman, you should look at this.
What is it?
Your genitals, they're engorged.
I drink anymore, I'm gonna explode.
You're not gonna explode, you're just gonna have a seizure.
You're an ass.
You were wrong. It's not the end of the world.
Inflammation of the genitals means we were wrong.
Just get the moron a drink so he'll shut the hell up.
Shutting me up is a crappy reason for compromising what you believe.
Not even an effective one, apparently.
I will allow you to throw the first punch.
She's getting better?
We're gonna need to treat you as well.
No, she doesn't have radiation poisoning.
The only way you can know for sure what wasn't killing her is if you knew what was.
Because you've been poisoning her.
Just get out and give up.
That's your specialty. 3, 2. What a lovely day.
Are you poisoning me?
With Spanish fly.
He wasn't knocked out by the punch. He was knocked out by the clinch before the punch. He needs surgery. He's never gonna fight again.
House didn't take the compound overdose. I love how the producers toy with us to just make us think that he has lost it, and then bam, he hits back right at the end. Beautiful. Glomus tumor to the boxer and poisoned with Spanish fly, and the active ingredient cantharidin to our patient. I've got to admit, I've never even heard of that, so I had to look it up. It causes blistering of the skin and is seen as an aphrodisiac in Chinese medicine, hence the swollen genitals. That would be such a niche bit of knowledge to have. Toxicologists, are you there? Great episode. Loved the 2 stories and House's journey in the background. 8.3 out of 10 entertainment, 8 out of 10 diagnosis, and 8.2 out of 10 accuracy. All plausible here, even the glomus tumor that can overstimulate the heart when excited. But this episode doesn't make full sense until you watch the previous one, though, where a lottery winner needs to find his long lost love right here.